Welcome back to the channel. I hope everyone is doing well. I hope you're having a fantastic day so far. It's a brand new day with new opportunities, and in today's video we are going to be talking about nurses. Nursing is a big part of our healthcare system, and oftentimes it can be very difficult to find remote jobs in that career path. So in today's video, I am dedicating this video specifically for our nurses out there that are looking for opportunities to work from home. These jobs that I'm going to be talking about, they are fully remote positions, and you do need a nursing degree to be eligible for these positions. So let's just dive right in. The first one is with Devoted. So this one is a bilingual Spanish acute care emergency medicine nurse practitioner is whom they're looking for this role. That is the title. This position was posted not too long ago. They are still hiring right now. They are looking for multiple people. They do need you to have your license and certification to be in good standing. You do need your RN as well as APRN, which is nurse practitioner license. They are asking for you to have active BLS certification as well. So if you are bilingual in Spanish and English, this is definitely the opportunity for you. They talk about HIDIS, they talk about STARS, which is more Medicare related. Ensure that for Medicare members that they are receiving the best quality of care. That is really primarily what this is. They talk about COPD as well as hypertensive emergency type of procedures or experience is what they're looking for you to have. The salary range for this position is between 110 to 130 per year. That is the salary range. And typically these roles tend to be over 6 figures, so which is really nice. They are looking for you to start almost immediately. They do have $100 monthly stipend. You can decide to use it either towards your internet or your mobile phone payment, because you're going to be providing telephonic support, clinical support to different members or different patients. So that is the salary for this position. And if you notice, once you come here, there is another position as well, which is also acute care, but focusing on telehealth type of services. So for those that are non-Spanish speakers, this is another opportunity to consider. So this is another nurse practitioner role, and it pays very similar for non-Spanish speakers. So definitely want to think about, I know that not everybody speaks Spanish, so not everyone is bilingual, but in case you are, then definitely the first one is it. But should you not be a Spanish speaker, you are not bilingual, this will be the next opportunity to consider. I will make sure to include the link to this one as well in the description of this video so that you can go right into that also. All right, now we're going to move on to the next opportunity, which is also nurse practitioner role. This one is also bilingual, and it is with Monogram Health. So Monogram Health is looking for a nurse practitioner who speaks all the languages. They are not very specific with your bilingual. Monogram Health, very similar to the first one. One of the things to call out with this is that they are providing a sign-on bonus of about $7,500. So that is something to think about. Even though this is remote, they are also providing a paid relocation assistance. So that is something that was interesting as well. And it could possibly be because they have the flexibility to either do hybrid or in-home type of setup, so you have that option. So likely if you are planning to do a hybrid type of setup, the expectation will be to move close to an office, which they will provide you assistance with. So this position is very similar. You are going to be doing a lot of assessment, you're going to be doing a lot of exams, you're going to be providing, but in a virtual environment, you're going to be helping to guide patients on navigating their health better, even the healthcare system in general, helping to set up appointments, helping to triage them through the different stages depending on what your medical conditions are. Most of the times, individuals that are managing this type of capacity tend to have chronic conditions, so whether it's diabetes or chronic pain as a result of underlying diagnosis and so forth. So really, that's what primarily this role is all about. They talk about delivering evidence-based, timely care in a way that is empathetic and also very satisfactory to the patient because you're putting your needs first. That's really primarily what they talk about with these positions. They talk about being bilingual, which we already know, and having the active as well as unrestricted registered nurse and nurse practitioner certifications and license. In addition to that, they do say 2 or more years of direct patient care is required. So they want to see that you have cared for patients before. So that is something to think about. They are asking for 2 years or more in that capacity. So that is the second position. So we're going to move on to kind of lower level type of function, which are more case management type of work. This one is going to be the first one, which is the quality improvement specialist position. This position is asking for you to come on board and provide support with HIDIS. So we talked about HIDIS before. I did call out STAR as well as IDs before, being specific to Medicare plans, where you are ensuring that services that are being provided to that population is of the highest quality. So that's really what it is. You're going to be using a lot of reports as well as data to communicate the quality of such programs to ensure that they are in compliance with CMS rules and regulations. So with this position, they're asking for bachelor's degree. This one is not specifically calling out nursing degree specifically. However, it is in the preferred qualification list, as you can see on here. So it is in the preferred qualifications list. It's talking about medical assistant or LPN. But bachelor's degree is what they're really looking for, as well as 3+ years of relevant experience. It also talks about Microsoft Office applications, talks about effective writing, and this is a fully remote position. The salary for this position is between $54,000 and $73,000 per year. All right, so we're going to move on to the last opportunity, which is with Molina Healthcare. So Molina Healthcare is looking for a senior abstractor, HIDIS, as well as quality improvement specialist in this case, right? So they are looking for someone who has some knowledge as well as experience in HIDIS. So they're looking for you to come on board and ensure the quality of the program. They want to make sure that the quality is top notch, that is the best, and you're going to be doing a lot of monitoring around that to ensure that if there are any kind of concerns or issues, that they are addressed and resolved as quickly as possible so as to make sure there are no gaps in quality. Bachelor's degree is required for this position, and they are also asking for 3 years of experience in healthcare, specifically HIDIS or quality. And then preferred qualifications, they do talk about 3 years of medical record abstraction experience. They talk about knowledge of HIDIS as well as NCQA. And you see under the preferred qualifications, they do have active RN in the states, for the states of employment. And the pay range is between $19 and $42. That makes a lot of sense. It's quite wide, but I see what the reasoning is behind that. So should they hire somebody with an active RON license, the person is likely going to be paid closer to the $42 versus someone who is not licensed, right? So those are the RN jobs. I do have a bonus role, which is with the New York Times, and this position is titled Copy Editor. And this is a temporary position. You are going to be providing editing support because they receive a high volume on a daily basis of different content. This individual is going to help bring that volume down by providing support for international weekly review of different pages, publication styles, making sure that they are up to standard. It's going to also help to keep the production schedule up to date. Just keep it going, because a lot of times things can get paused because of too much work or just inability to have the time to review the volume of work coming in. So that's why they are looking for this individual to come on board and assist. They're asking for at least 3 years of experience as an editor or designer, bachelor's degree in journalism, and at least 1 year of experience in Adobe InDesign as well as in copy. So the salary is between $19 and $24 per hour. That is the range. So depending on what experience you bring to the table would determine where you fall. They do have some preferred qualifications here as well, but these are more soft skills. They're talking about being able to manage multiple projects, someone who can work in a remote environment, and also someone who is very strong in terms of understanding of different events around them, which is really key to this position. And that's all they need for this position right now. So if you are interested, you should definitely go ahead and submit your cover letter as well as resume. So should you have any questions about any of these roles, please come back, leave it in the comment section. Subscribe to this channel if you've not subscribed already. Till next time, I wish you guys all the very best of luck, and I will catch you in the next one. Take care, guys. Bye bye.